The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by InMode Aesthetic Solutions.
So we have, let's see, a few more people waiting, and they're being admitted, so that's good. So I'm going to start speaking with the slides, and I don't want to take a lot of your time. And then we'll have some time at the end for questions, all right? So I'm going to share the screen here. Let's see if I can share that. Okay. Let me see. There. Okay, good. Can everybody see that?
Yes.
Okay, good. I think I forgot to mute everybody, so try to mute yourselves so that I can continue this one, okay? All right. So this is my talk. Let's see. It is now 10 after 10. So we'll take about 20 minutes, and I'll just try to educate you about what is happening in peri-pandemic situation. And I had this idea with Dr. Hussein to bring about this international long COVID treatment and reversal centers, because long COVID is something that's happening post-COVID and post-vaccine. So there are a lot of effects of the coronavirus on the cardiovascular system. And this is a really great slide. It's really busy, all right? And I know that a lot of you are not used to watching slideshow presentations, so I tried to cut it down to a few slides, but there still are a lot of good slides that I wanted to show you some great information. So this virus comes and directly attacks the vascular system with a lot of inflammation, changes in the initially respiratory system, and then affecting the heart. And we have something called pro-inflammatory cytokines. These are all these things that are floating around in the blood, causing damage to all the arteries. And patients don't really know this. They may have had a bad COVID. They may have had 2 days of a runny nose. But what happens is the inflammation is the same. And later patients are presenting with heart failure, arrhythmias, or changes in the rhythm of the heart, and actually heart attack and stroke. So this is what we as doctors are seeing around the world. And patients need to know that this is a great danger now. In the next year or 2 or 3, we don't know how long. And that's why it's so important to get this information out to patients. And there are a lot of risk factors that I have talked about for many years with my patients about endothelium, or the lining of the arteries. Because remember, the answer is in the blood. So the blood is circulating, and in those tubes called arteries and veins. And in the arteries and veins, there's a lining on the inside, and that's called the endothelium. So that lining becomes injured, and we already saw injury of this lining with diabetes and high cholesterol and high blood pressure. But now you throw COVID on top of it, and you see a huge increase in inflammation. The lining becomes destroyed, and oxidative stress happens. That means there's a lot of inflammatory markers hitting the lining of the arteries, causing breakage of that. And people can present even in this young patient that was reported in 2020, in May of 2020, where they presented with a stroke in a very young person. So this is what we're up against, strokes and heart attacks. Atrial fibrillation is an irregular heart rhythm that a lot of people know about. And this is a mechanism that actually can cause stroke as well. So we saw a lot of patients, about 23 to 33% of recurrence of atrial fibrillation in patients who presented with pneumonia and sepsis. And you all heard about this throughout the world, I'm sure. Initially, when people were becoming sick with COVID, there was a lot of death because of ARDS, or respiratory distress syndrome. So atrial fibrillation became very rampant in those patients, and even new atrial fibrillation was occurring. So we're seeing a lot of these kind of rhythm problems. So one thing that we've brought to the UAE, and I've talked with some of the doctors there about it, and Dr. Hussein is associated with this Holter Connect, which is a special patch that we actually use here in the US for many years that can actually detect arrhythmias, rhythm problems. So people can be walking around and say, I feel okay. Sometimes I'm dizzy a little bit, or sometimes I feel a little weak, but they may be having really bad arrhythmias. So a great way to detect an arrhythmia is to put this patch, which doesn't have any wires or doesn't have anything constricting, and you can take a bath and you can do all the great things that you need to do. It's a great way to measure the rhythm, evaluate the heart rate. And we now have that in the UAE. And of course, we have it in the US. Now, heart failure. Let's talk about heart failure. What happened with COVID-19 and heart failure? We saw a huge increase in heart failure because of respiratory distress syndrome, as well as increasing this, we call it sympathetic activation. So again, a lot of cytokine storm causing inflammation of the heart, and the heart was becoming weak in many, many patients. And I've seen patients come into the hospital, their heart function was normal, and now it's 23%. So very, very, very interesting that COVID was not really a respiratory disease, or the COVID vaccine, the things that it caused was not really just inflammation, but actually affecting the heart. So it's really a cardiovascular disease. And there's a great mechanism of treatment that I talk about at this conference called the 4TS Conference Worldwide with the Emirates Cardiac Society. And I've taught many people here in the US about how can we improve the hemodynamics from some things that we already know. This is a really interesting slide. It's a cardiology slide, so it's not scary. Don't worry. There's an area. Well, let's see. We'll keep going. So the coronary arteries fill in a stage called diastole. That means the resting of the heart. So when the heart is resting, we can increase the blood flow. And some of my patients, actually, Mr. Dunn has been on this ECP therapy here, and several patients, of course, that I've seen in the US as well as now in the UAE. We have this ECP procedure. So they've done it. They've already benefited from it.
Yes, please.
I just saw a video of a doctor who had undergone ECP therapy, or external counter pulsation, and he was commenting how much he had improved with regard to pain in his legs and stamina and pain in his chest. So external counter pulsation has been around for a long time, since the 1950s. A series of cuffs that are wrapped around the calves and lower legs, upper thighs, and buttocks. And this is an amazing therapy that actually unloads the heart. That means increases the strength of the heart. And you can see here that the history of this external counter pulsation is long-standing, and the multiple clinical trials. And I even talked to Dr. Atef about this because he has a rehab hospital. He said, "Let me know about this." So I said, "Come on this lecture, and you'll hear about it."
Very, very interesting. Yeah, I agree with you. Yeah.
Yes. So the external counter pulsation increases the time to what we call exercise-induced ischemia, or that means it helps the patient to prolong their exercise without having chest pain, or without the heart having a problem getting the blood flow. Actually, it creates new vessels. It's called neovascularization. So this is a really cool slide, and I show it to my doctors, where it shows here that we can, if a patient is in stage 3 and 4 heart failure, we can bring them down to stage 1 and 2 heart failure after 35 sessions of external counter pulsation. So that data is out there, it's published, it's covered by Medicare, all of that. So I wanted to see, can ECP benefit beyond the cardiovascular disease patient? Is it important in post-COVID patients? And yes, we saw that this is a heart failure study that showed external counter pulsation improving heart failure patients. It's in the guidelines. This is the American College of Cardiology and American Heart Association guidelines. All right. So these guidelines show that alternative therapies for relieving symptoms of chest pain And shortness of breath, external counter pulsation is listed there. So we have a great, we call it weight of evidence for the benefit of external counter pulsation in treating patients with coronary disease and heart failure. But now we know that because of these mechanisms of COVID-19, where we see increased thrombus or clot formation, ECP can benefit in protecting those patients. And I'll show you why. This is that cytokine storm that I talked about, thrombosis. So the COVID virus and or the vaccine, as we can see later, increases all of these things that are associated with inflammation. And that's what we call, so nitric oxide is one of the keys. And external counterpulsation actually helps to improve nitric oxide production. So it's a beautiful mechanism for helping treat patients who have had COVID-19 or people who have had the vaccine and have a huge cytokine storm rush. So this is how the COVID-19 begins with this acute respiratory distress, moves to all the vascular networks or all the vessels. And then we see platelets and the lining of the arteries, things that start clotting become really rapid. And we see a lot of clot formation in multiple vascular beds, means in the veins, we see a lot of deep venous thrombosis, pulmonary embolus, coronary artery thrombus, thrombus in the brain, such as happened to my dad after the vaccine. So this endothelial dysfunction causes a decrease in nitric oxide production. And nitric oxide is so important because that's what actually helps to dilate vessels all over the body. So how do I measure this inflammation? And I think we're going to talk for like another 7 minutes maybe, and then we'll take questions. How do I measure this inflammation? And the beauty of this lecture series is, I'm going to kind of give you a little tidbit of information, and then later, more lectures, we can talk more and more in depth about things and how we can prevent all of these things. But one of the things I use in my clinics around the world is this pulse cardiac test, a simple blood test, and it really looks at endothelial damage. And my patients in the US are very lucky that we're able to do this under insurance coverage. In the UAE, we're able to do it, but it's still not covered under insurance on every insurance. But it really shows what's happening at the lining of the arteries. We know that the COVID virus attaches to something called the ACE2 receptor, and that is in the lining of every artery and vein around the body. So we can measure what happens to the endothelium with this pulse cardiac test, because there are these consequences of the vaccine and the virus that everyone needs to know about, and it all stems at the endothelium or the lining of the artery. And that's where the pulse cardiac test can help us. What happens after the vaccine, you may ask me? Well, people can have anaphylactic shock, thrombosis, low platelets, bleeding, nervous system abnormalities, the Guillain-Barré syndrome, myocarditis means inflammation of the arteries, and pericarditis, inflammation of the lining of the heart. Let me just check and see. I want to make sure everybody's getting in. So we have people joining in. Yeah, there we go. And inflammation of the lining of the heart, and people can die from this. So this is definitely something very important to talk about, and that's why I was really compelled to do this lecture series. So we know that ECP is one of the things I'm talking about. Nitric oxide is one of the things I'm talking about that can be a help in the prevention and reversal, early treatment of this endothelial dysfunction. We have to be very sensitive and appreciative of the lining of the arteries. It has the most surface area of any organ in our body. So the endothelium is the most important organ that we have, and we want to take care of it. Increase the nitric oxide. Many times I'll put my patients on nitric oxide supplement post-COVID, or if they're having difficulties post-vaccine. We know that ECP is beneficial in reversing this dysfunction and the thrombosis associated with it. This is a really cool slide, and we're almost done, but I wanted you to see it's a lot of big medical words, but the beauty of this slide is on the left side, you can see what's a normal endothelium, how does it work? And then what happens when the COVID virus or the vaccine-related inflammation, what happens? It changes everything on that lining and decreases the production of nitric oxide. So when we do this external counterpulsation, or that bed that patients lay on, where their legs and their lower torso is squeezed continuously with every heartbeat for 1 hour for a day for 35 sessions, we see all these benefits, increasing things that stop inflammation. Those are prostacycline, TPA, superoxide dismutase, glutathione. You guys have heard me talk about that around the world for many years, but I think, thank God that I knew about these things, because who knew we were heading into a pandemic that would cause problem with these types of things. So if we can produce this anti-inflammatory endothelial phenotype, or the lining of the arteries will get better, we can prevent this kind of post-COVID long hauler syndrome. And anybody can get this. It's not related to severity of the disease. It can be in women, men, teenagers, hospitalized, non-hospitalized patients. And patients are presenting to me with severe fatigue and brain fog, shortness of breath, rapid heart rate, dizziness, digestive problems, changes in their body temperature, can't sleep, they're just fatigued. It's a big problem now. And if we do a skin biopsy on patients who have this questionable long hauler syndrome, we'll see small fiber neuropathy. And in my clinic here in the US, and also there in Dubai, I check for these things without doing a biopsy. We can do something called the autonomic nervous system testing, very beneficial in determining this early change in nerves and autonomic dysfunction, which can be long lasting if we don't evaluate it and take care of it. So again, this is why I am trying to teach people around the world about, what's happening with this COVID, post-COVID vaccine and post-COVID syndrome. And is it related to the microcirculation or the small arteries and veins and endothelial dysfunction? Yes, I think so. And so do people around the world. There was a data published from Tunisia talking about, and this is kind of a complicated slide, but it just shows that COVID is a multi-system disease and affecting the lining of the arteries. If you see that lower statement, long COVID-19 symptoms, specifically non-respiratory symptoms, are due to persistent endothelial dysfunction, where the lining of the artery has been affected. And these findings allow for better care of patients with long COVID-19 symptoms. Here's a great paper talking about a 38-year-old woman who suffered from fatigue and headache and body pain and shortness of breath. Now, I will tell you, I'm seeing a lot of those patients. They are coming out of the woodwork because, maybe their primary care, said, okay, you have COVID, and got them through it. But now they're having all of these changes. And this woman underwent external counterpulsation therapy 3 times a week. And after 1 week, her brain fog had improved, because we know that this therapy is increasing the circulation throughout the body. And so her brain fog improved. And then after 5 weeks of ECP treatment, she was back to normal. I think that's a beautiful rendition of what can be done with external counterpulsation. So the take-home pearls for today, and I don't ever want these lectures to be too long where you're bored, but I want them to be enough where you can take some pearls away. That external counterpulsation is a great treatment for post-COVID-19. It's in the literature, it's been published, and of course, this is also new that, of course, there are no clinical, long-term clinical trials, but we have published data about it. we can help the autonomic nervous system and the endothelium, or the lining of the arteries. So I'm going to stop that sharing. I hope that that was beneficial for everyone, and you guys can unmute yourselves. And I see we have a lot of great people, a lot of I love you all. I'm so thankful for friends around the world, really. And to do this in a patient-mediated setting is more fun for me than talking to all these thousands of doctors around the world, although I love them as well. So unmute yourselves and please ask or make a comment or ask a question. We would all love to hear what you have to say.
Can I start, if you don't mind?
Absolutely.
Yeah, just let me introduce myself to my friends here. Actually, my name is Dr. Beta. I'm a CEO of a hospital, which is a long-term rehabilitation hospital. And we are very interested to start the program with Dr. Annie. Hopefully, we will meet here very soon in Dubai, inshallah. Very soon. Okay. About this meeting, about this lecture, it's really, for me, it's very useful, and it's full of information where I'm going to discuss with you, Dr. Annie, regarding the post-COVID rehabilitation that we would like to do with my patients, actually. Okay. And I would say also regarding the nitric oxide that I myself treated many of my patients here in Dubai with the nitric oxide chewing gums. Actually, I'm chewing tablets.
Nice.
I brought it myself from US actually, and I gave it to them, and it's really giving a results there. Where, as you said, it's by dilating the blood vessels, and it makes the patients feeling much better with this one, their immunity.
That's awesome, Dr. Ajab. I think you're so forward thinking in that. I think people who do physical medicine and rehab or rehab hospitals are really leading the way in this post-COVID setting, and I would love to be a part of that with you.
Sure, inshallah. And I would love, Dr. Anna, again to know more about this, the bag itself and the way it's really working. How is it working? So that might be one of our services and programs that we would like to do with our patients here in our hospitals in Dubai.
Yes, we will. And as we continue these lecture series, I'd like to do this every Saturday morning for me and Saturday evening for you all, so that we can get people educated around the world. And I'll be coming back to Dubai anyway in May, and then so we'll take a pause for those lectures, and then we'll restart again. We never know. God will open the doors to educate people. One day I want to see 1,000 people on this lecture series. Wouldn't that be amazing, that we can really help people to change their life? I mean, that's why we're here. Right? And you all take this information and tell people next week to join in, because, I will be taking it again a little further, a little deeper on the prevention and reversal. We already have enough to suffer, right?
No, we don't need. We don't need that. Yes.
We don't need any more suffering. Let's see if I want to admit some more people who have come in. And in the meantime, let's see, Pastor Donald Benedict, I see him there. He's a pastor, world-renowned, and he's staying quiet there, but I want to say a few words, what he thinks about this.
Thank you so much, Dr. Annie. It is indeed a privilege to join this lecture and learn. I'm not a medical professional, but I have undergone a CABG 6 years ago, and I know what it feels to have a second lease of life. And I wish I knew what you shared years ago. Nevertheless, I believe what you're sharing, what you're teaching and imparting would really be a blessing to many, especially as the world has faced such a severe pandemic and so many changes in the health of mankind, especially those with cardiovascular challenges or diabetes or other illnesses. Thank you so much for the guidance. Nitric oxide, yes, it surely helps. It surely helps. I have tried it. I have used it as a supplement, and I have seen the impact that it has made. We look forward to many more lectures. And as you said, it's your heart desire to see thousands join. I'm sure that will come to pass by the passion that you carry, the services that you provide, and the heart that you have to reach out and to take your father's vision. That is powerful. I'm so blessed to know that your father had a vision. Though he is not on this planet today, you are carrying this vision further. And we're so proud of what you're doing. You are truly a blessing. God bless you.
Thank you. Thank you, Pastor. It's a great pleasure to teach everybody. Does anyone have any question or a comment? Dr. Hussein, are you there?
No,
Yes, I'm here.
Great. Anyone have any question or comment? And do you think that you can tell one person to join you next time? Each one of you, if you tell one person, that'll be double the people that we have. Is there anything that I didn't answer for today that you have a burning question about? Yes, I want to just tell everybody I love you all. What we need to do on Zoom is always make sure that you mute yourself until you want to say something, and then definitely unmute yourself. So that way we can all enjoy what's happening.
Thank you very much.
Dr. Annie, I'd like to thank you for this beautiful information. Thank you so much. You're awesome.
Safa is a wonderful friend here in the U.S. as well as in Dubai, and she represents the pulse cardiac test. And so, if anyone has any questions about these things, just text me. You all have my WhatsApp, and I will get you with the appropriate people, either Dr. Hussein about some of these supplements and things that we do there, or the external counter pulsation, the bed information, all of that we can get over to you. And of course, Dr. Ataf will be talking to you about starting that program there for Aline and Dubai, as well as the U.S. here. U.S., we are also starting the post-COVID program with Woodland Specialty Hospital and Northeastern Family Medicine. So my patients here also can be experiencing the benefits of that as well.
Okay.
I'm going to wish you all an amazing evening and an amazing day, and I will see you all next time. All right.
Thank you.
Thank you all.
Thank you so much, Dr. Annie. Thank you. Have a wonderful day.
Thank you for coming. I love you all.
Thank you.
Bye-bye. We love you. Thank you. Bye-bye.
See you later.
The V-Life with Dr. Annie is produced by Advanced Cardiovascular Care Center with educational grants from Amazing Lines, Dolce Vita Cardio Advanced Med Spa, and sponsored by In Mode Aesthetic Solutions.